Hi, I'm Dr. Sean Chaudhry, a board-certified chiropractic neurologist, one of only 1,000 in the world. Now, if you're watching this video today, you've requested information about chronic neck and low back pain. And why do people look for us for answers when you find that there's chronic neck and low back pain? Is because you've already seen your medical doctor, you've already seen your chiropractor, your physical therapist, your massage therapist, you've already had medications, injections, and what we know is that probably hasn't worked for you yet. And the reason is there's those three basic factors that you have to look at for any of these chronic conditions. Now, first thing that you want to look at is where's the actual musculoskeletal problem. What I mean is where's the problem in the muscle, the bone, or the disc. Now, there can be a problem with the muscle, the ligament, the tendon not being right, the fascia. We know that any of those things can be a problem, and they're all individual problems. And we know the next thing is you have to evaluate the bone. You need to find out, is there a problem with the weakness in the bone? Do you have osteopenia, osteoporosis, or any of those kind of things going on with the bone, or inflammation of the bone? What we also know is that there can be a problem within the disc. Now the disc is between each vertebra within your body, and it's made mostly of water, right? 90%. So what we know is that there's a center substance that's in there called the nucleus pulposus. Now that area is supposed to stay within the annular rings of your disc. Now what happens if there's damage to the annular rings, you can have a disc bulge, you can have a disc protrusion, you can have a disc extrusion, you can even have a sequestration. And what we need to know is how bad is the disc injury in your back. Now the disc injury doesn't correlate with how much pain you have, because you can have a small disc injury and a lot of pain, and a large disc injury with a little bit of pain. So even though any of those things can cause a problem. The second thing that we have to look at is the neurologic system. We know that the brain controls everything. It controls the spinal cord and then the nerves. And the nerves go into your arms and your legs. That's why you can get radiating pain, numbness, tingling, and all of those areas. But the thing is you have to figure out exactly where is the problem. Is the problem at the end organ? Is it at the carpal tunnel? Is it up in the brachial plexus? Is it in the neck? Or does it mean it's coming from the brain and the brain's not feeling what's going on? Now, you have to remember from back in school that the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. So what happens if one hemisphere of the brain isn't working quite the way it should, then you'll have weakness on the opposite side of the body, and you may hear this from your doctor, your chiropractor, or your massage therapist. Well, one side of your body seems weak and the other side of your body seems tight. So what we have to do is we have to figure out which side of your hemisphere isn't functioning as it should. Now, what are some of the other signs and symptoms that you may notice? Now, when the right hemisphere isn't functioning quite the way it should, we know that you can feel that you're having ADD or problems with attention and focus. We know that you can have problems with direction. We know that you can have problems with withdrawal. Your sympathetic nervous system or your fight or flight nervous system, it could be overworking. So we know that there's a bunch of things that can go on if your right hemisphere of your brain isn't working the way it should. Now, the left side of the brain controls more auditory processing, depression, dyslexia, feeling down, decreased motivation. So these are some of the mental things that you may notice when you're noticing that there may be some musculoskeletal problems as well. Now the last thing that we need to worry about when we're worried about chronic neck and low back pain is the functional blood chemistry. And what I mean by that is that there's different things within your blood that can cause pain, that can cause inflammation. And what we know is that when those things get inflamed, that's a lot of times why your doctors will prescribe anti-inflammatory drugs. They may give you an injection. They may do steroid injections, those kind of things. So what we have to do is we have to find out, why is your body inflamed? Why is there pain? So the thing is that what we do here is more of a fix. We're not looking at one thing that one of your doctors looked at. We're looking at all of the things that go on. Now, you're asking yourself, well, what makes you guys different in respect to how you treat? What are the different things that we could do to help you? Now, what we do to help you is this. Number one, we have something called the Pro Adjuster. The Pro Adjuster is a computerized instrument that allows us to manipulate your spine with a computer. It uses a piezoelectric sensor. It's the same things that they use in NASA to measure the amount of balance and the amount of stress that's on the strut. Now what that allows us to do is it allows us to know where the problem is in your back in a computerized fashion where there's no twisting or popping. Because a lot of people are worried about that when they go see certain doctors. Now the next thing we have is something called Chattanooga traction. Chattanooga traction allows us to work on the muscles in your low back, the discs and all of those things. It allows us to take some of the pressure off the nerves in your back. But the ultimate goal is if you have a herniated disc, a bulging disc, a protruding disc, sciatica, or any of those major things, and you want to prevent surgery, we have the DRX 9000. Now the DRX 9000 is a piece of equipment that's state-of-the-art. There's only 2 of them in the whole state of Louisiana, and we actually have 3 of those units here within our office. Now at the recovery clinics, what we're able to do is actually prevent you from having surgery almost 90% of the time. So what you have to do is you have to come in and get an evaluation. We need to check out what's going on with your blood chemistry, your neurologic system, and your musculoskeletal system, alright? Now from there, we can find out if you've had a failed back surgery or any of those kind of things, and we're able to even help those. So if you're looking for answers, and you're looking for somebody that's going to actually take their time to look through all those things, because at this point, you're either facing surgery, you've had a failed back surgery, or what your other doctors have done hasn't worked, then you need to call us.